This is Ariel, and I wanted to talk about today specifically the occurrence of post-traumatic stress disorder in people who have epilepsy. So post-traumatic stress disorder is mostly talked about in relation to military personnel and combat events during combat being traumatic, and then having the post-traumatic stress disorder when you return. And so I'm actually going to talk about it in the instance of having seizures, and that those can be extremely traumatic. And so I have been diagnosed with PTSD, and I have lots of years of traumatic events occurring related to my seizures. So I know that it may be a newer thing for some people to even hear about this. I know some doctors, this is not something they had thought of necessarily. I did bring up here some of the actual literature from the Mayo Clinic's information on post-traumatic stress disorder. I think it's helpful to look at the language that they use and see that your seizures can actually fit into this, and so you may have PTSD from having even a few seizures, but especially if you're someone who's had years and years of having a lot of seizures. Tonic-clonic seizures can be extremely traumatic, as well as partial seizures. Personally, my simple partial seizures have been one of the most difficult things to deal with because I have had very unusual simple partial seizures that I did not understand that they were seizures for a long time. So I was having a lot of trauma trying to deal with them in public, in situations that I became endangered because of them. And sometimes it was even the confusion related to having a seizure. Sometimes it was the thoughts. Sometimes it was, most of the time it just had a lot to do with not being able to think clearly. So making decisions that ended up being life-threatening sometimes. So that happened with my partial seizures. And then, of course, I was in the situation of having life-threatening situations based on having tonic-clonic seizures. So I was aware of all of this, and the simple partial seizures, you have full awareness and consciousness. So those actually can be very traumatic because you do experience all of it and you remember all of it. Here is a few things about PTSD. It is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. And symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. That's just a basic definition. If your symptoms get worse or last for months or even years and interfere with your functioning, you may have PTSD. So it's definitely talking about severe trauma that causes a severe reaction. Sometimes people witness this trauma. Sometimes they experience it themselves. The PTSD symptoms are generally grouped into 4 types. You have oftentimes intrusive memories, avoidance, negative changes in thinking and mood, or changes in emotional reactions. So one of the main things that people know about with PTSD is the intrusive memories. So sometimes you can have just recurrent, unwanted, distressing memories of the event. Sometimes you have flashbacks, which is like where you feel as if it's happening again. Then there is dreams, that happens to a lot of people, and severe emotional or physical reactions to something that reminds you of the event. So there's also this fact of things can be related to the event or events in some cases, because if it is a recurrent thing, such as having traumatic seizures, then anything that reminds you of that, relates to that, can cause reactions. The avoidance basically is either trying to avoid thinking or talking about the traumatic event, or avoiding places, people, or activities that remind you of the traumatic event. So it can be both. It can be that, you have an avoidance of talking about it, or it can be that you actually avoid going certain places. Personally, that's one of the things that happened to me. I became extremely scared about certain things, such as public transit, because I would have seizures and I would actually get off the bus in the wrong places. I would get extremely scared too when I had a seizure, because I was so confused afterward that then if I was in public and I was alone, I was really scared. And so then it became worse, because the more I had them, say on the bus, when I was not able to drive for 7 years, the harder it got to ride the bus. So sometimes it can be really basic, simple things. Also, there's negative changes in thinking and mood. And symptoms of negative changes in thinking and mood may be negative feelings about yourself, inability to experience positive emotions. Feeling emotionally numb is another one. That's a big one. You know, if you start to lack of interest in activities you once have enjoyed, hopelessness about the future, memory problems, and especially not remembering parts of the traumatic event. So obviously with certain seizures you have a lack of awareness or consciousness, you're not going to remember that. But, you know, the things around the event, a lot of times people who have PTSD don't actually remember everything. Then there's difficulty maintaining close relationships. So having difficulty being open enough and trusting enough and grounded enough to have close relationships takes a certain amount of clarity and being centered and not being in a traumatic, confused state a lot of the time. Also, changes in emotional reactions. Some people have irritability, angry outbursts, or aggressive behavior. Most people with PTSD are kind of on guard for danger. There also is a problem with overwhelming guilt or shame, self-destructive behavior, drinking too much, driving too fast, cutting, you know, all kinds of things. Trouble concentrating, very common. Trouble sleeping, very common. And being easily startled or frightened. So this also depends on your symptom severity. So you may have had different things happen and they weren't extremely severe trauma for you. For some people they are. For some people their seizures are severe trauma. So it's really important that if you think you possibly have PTSD that you talk to a doctor, and you can get help, and there is treatment for this. So I see that it can be common in people with epilepsy that has caused them trauma. I personally have it, and I really want there to be more information and talk about it out there because these are real problems. Yeah, I mean, this is not just something that some people have. This is an experience that maybe more people than we realize are having. So the kinds of traumatic events that can cause PTSD is oftentimes combat exposure, which I talked about, childhood neglect and physical abuse, sexual assault, physical assault, and being threatened with a weapon, as well as things such as fire, natural disaster, mugging, robbery, car accidents, plane crashes, torture, kidnapping, life-threatening medical diagnosis, terrorist attack, and other extreme or life-threatening events. For some people, you also don't realize that some people feel that their seizures are life-threatening, and for some people they are. And being in certain situations, then having a seizure, it can be life-threatening. And so it is really traumatic for certain people. If you're having lots of seizures in very safe situations, it may not be as traumatic. Also, PTSD may increase your risk of other mental health problems such as depression and anxiety, issues with drug or alcohol use, eating disorders, and suicidal thoughts and actions. Definitely happened to me. I had an eating disorder for many years. It's hard if you feel like you can't control your safety. Sometimes you feel like you need to control something. There is the Dsm Criteria. So at this point there is the Dsm-5, which is the diagnostic manual for mostly psychiatric conditions. So the diagnosis of PTSD requires exposure to an event that involved or held the threat of death, violence, or serious injury. And either you witnessed the event, you experienced the event, you learned someone close to you experienced or was threatened by the traumatic event, and you were repeatedly exposed to graphic details of traumatic events. So that can be people like first responders at scenes of traumatic events. So, like I said, many of the symptoms include memories, avoidance, negative mood and thinking, and changes in emotional reactions. So if you have those, and like I said, you have had an experience that fits into, you know, a traumatic experience, then you may need to get help. And a lot of times psychotherapy is used in this case. Cognitive therapy, exposure therapy, and EMDR are common. It's common to use medications such as antidepressants and anti-anxiety medications to help control and possibly help to change the thinking and bring down some of the stress and anxiety, which can over time also lead to feeling safer and then adjusting to the fact that you're in a safe environment, if you are at this point, to be able to realize that at this moment you are not still involved in that unsafe event. But it's very hard to feel that way if you are still in an unsafe situation. So a lot of times if you have trauma and then you keep feeling that you are in an unsafe situation, say you keep having seizures in unsafe situations, then that can increase the trauma. It can go on for years of trauma, make it really more possible and more, makes it so that you are more likely to get PTSD from a traumatic recurring event. One of the main things to do is to follow your treatment plan, learn about PTSD, take care of yourself, don't self-medicate, break the cycle, and talk to someone, and consider a support group. So all of those things are good ideas. There's also information for when you love someone who has PTSD. If you think someone in your life has PTSD, or if you are a person who is knows other people that have epilepsy, is a parent of someone with epilepsy, is a friend, partner, whatever it is, you may also realize that someone you love has PTSD. And in this case, I'm talking about PTSD and epilepsy. So really think about this. This is very important. This is the clinical data. Personally, I have had over 100 tonic-clonic seizures. Many times I woke up and I was in an unsafe situation. Like I have said before, I fell down the stairs, woke up at the bottom of the stairs, woke up having hurt myself many, many times. And also, I don't know how to explain it sometimes, but when you wake up from a seizure and you hurt so much and you have a headache and you feel confused, it kind of feels like somebody beat you up. And it feels very violating. And for some of us, I think that experience, when it continues over and over, and you keep waking up feeling as if, coming back to consciousness, feeling as if you have been violated, then that is very traumatic. In my case, I also was having these partial seizures that were very traumatic for me. They caused so much confusion, and I was unable to get out of them. I was having a lot of them, and I didn't know what they were. And so that was really confusing in itself. Also, my brain was not working as well because I would have one and I would feel really confused. So making decisions was very difficult. So I made some decisions at certain times that put me in a lot of danger. Living in cities and getting lost. Living in cities and taking public transit and having seizures in public places, lying down in public places because I was so triggered by seizures. I was having a seizure and then I was unable to deal, so I would lie down in, a train station. All kinds of things. So the partial seizures can be extremely traumatic as well. Also, just having them, if you do have partial seizures that you experience and remember, if you have, say, this sudden rush of fear like I do oftentimes when I have a partial seizure, and a deja vu and stuff that is scary, fear is oftentimes one of the symptoms of a partial seizure. And if you feel that, you feel endangered, that can be traumatic too. Because then, like I said, oftentimes you put yourself in danger because you don't realize that you're not thinking clearly. And the feelings of guilt and shame can go along with feeling that you can't control your epilepsy, feeling ashamed that you have these problems and you have seizures, not wanting to share them with people, feeling ashamed in school or with other people, the stigma surrounding epilepsy, worrying about what people will think, having a hard time sharing it with friends, family, new partners, in relationships, all kinds of situations, sharing at your work, stuff like that. Then having, had a seizure. I have a friend who fell off a ladder one time. You wake up from things like that, and it is very traumatic to have fallen off a ladder and gone unconscious and hurt yourself and had a seizure and wake up feeling like somebody beat you up. That is traumatic. So I am really interested in the possibility that this is something that we don't know much about, and that there are more people out there besides myself that have PTSD and epilepsy, and may very well have the epilepsy be a major factor in the PTSD. I also had some traumatic events when I was young, but that can set you up really well for trauma when you're older, creating PTSD. So a lot of people who have PTSD also had some kind of trauma, abuse, neglect, things that were possibly not even anyone's fault, because my parents were actually not abusive or neglecting me, but there were some things that happened that increased my trauma then. And then as an adolescent and a young adult, when I was having lots of seizures, I definitely got PTSD from that. So if you've had trauma, if you now have trauma, and if it's recurring especially, and I know so many people that continue to have seizures for years, and if you find it really traumatic, some people don't seem as upset by their seizures. I personally think it is very dangerous, life-threatening, a big deal, and traumatic for me. So, it might also be traumatic for caregivers, people who watch their kids have seizures, watch them. In my case, I used to turn blue because I had a lack of oxygen. They would go on for 5 minutes, 15 minutes. That's really dangerous once you get up to longer than 5 minutes. So people around you are even also possibly getting some trauma about your seizures. So if you are a caregiver and you have had a child or a loved one that is having lots of seizures, you also have to watch out that you may be getting traumatized. Now, I'm not saying that we need to, if you have epilepsy, don't worry so much about everybody else getting traumatized. You need to think about whether you're getting traumatized. So it is important to realize that epilepsy, seizures, and everything that goes along with it, including the issues that happen because you have seizures, like I said, being in dangerous situations because you're having a seizure and you're so confused, that can be really, really traumatic and lead to PTSD. I think it's really important that you realize the severity of your symptoms, if they are severe, and what that could mean for you and what you can do about it. You can get help with PTSD. You can see a psychiatrist. You can even see a doctor that is just a general practitioner. Oftentimes, if you have symptoms of any kind of psychiatric disorder, depression, anxiety, and or PTSD, other things, you can get help from them, or they can refer you to a specialist such as a psychiatrist who can really help to determine if you have this. They can give you the diagnosis, and then it's it's really helpful because if you know that you have something, you can learn about it, you can try to meet other people or connect with other people with it, with similar experiences. You don't feel so alone. And you can share with your family and friends more easily, maybe not easily, but a little bit more easily about what you're experiencing, because you realize that you aren't alone. You're not the only one that feels this way. It is something that happens, and you're not need to be ashamed about it. You don't need to, feel bad about it. This is something that happens, and it's important to share. It's important to get help.